Well, good evening, everyone. I hope you enjoyed watching that documentary very much. I'm Nancy Baxter. I'm the head of the Melbourne School of Population and Global Health at University of Melbourne. And I'm pleased to be the moderator tonight for our panel discussion of that fabulous documentary, How to Survive a Pandemic, as part of the Australian Global Health Film Festival. With me today, but first of all, I'd like to acknowledge that I am on the lands of the Wurundjeri people, who have been custodians of this part of Australia for thousands of years and many, many generations. And I pay respect to their elders, past and present, and look forward to our shared future together. And I invite you to take a few moments to acknowledge the elders wherever, on whatever lands you may be on. I'd like to introduce our fantastic panelists tonight. First of all, we have, of course, David France, who is an Oscar-nominated best-selling author, award-winning investigative journalist who has produced some of the greatest documentaries of our time, including How to Survive a Plague and Welcome to Chechnya. So David is here to help us discuss the documentary. We have Leith Greenslade, who is the founder and CEO of Just Action and coordinator of Every Breath Counts. She's the winner of the Social Impact Award and Global Australian of the Year in 2021. And to quote Leith, she builds coalitions to tackle the world's greatest injustice. So Every Breath Counts is a coalition, a collection of 50 organizations, and is the world's first public-private partnership supporting low and middle income countries to reduce pneumonia deaths, including deaths from COVID-19. So welcome, Leith. And then we have Brett Sutton, who is, of course, our Chief Health Officer in Victoria. He's a fellow of the Royal Society for Public Health and fellow of the Australasian College of Tropical Diseases. He's an expert in public health and communicable diseases, and gained a lot of experience in providing emergency medicine and also field-based international work in both Afghanistan and Timor-Leste. So I think we'll have some very interesting perspectives from in the trenches in Australia in terms of dealing with the pandemic, but also in the global impact of this and our failure on a global stage in terms of protecting the world with the vaccines that have been developed. So, when I was asked to first moderate this, I thought that, one of the first things I'd do is go back and watch the documentary, How to Survive a Plague, which was just really a documentary that had a great impact on me. And if any of you in the audience have not seen that work by David France, I really recommend you do so. But, I really had to stop myself because I really didn't feel that I could see that again. I was a very young doctor, just an intern when in the early 90s on the wards on the hematology oncology ward of our inner city hospital in Toronto in 1991-92. And I must say the documentary really brought home to me the what we lived through then and what our patients lived through then. And it gave me a lot of perspective about what happened, what exactly happened, how that tragedy unfolded, and eventually was we developed effective antiretrovirals. But I just couldn't watch it again because it just made me relive it again, and not something that I really thought I could do. And in some ways, this documentary did the same thing because now with everyone vaccinated, up to 4 times, at least in Australia, we think that all of this was a foregone conclusion, and we forget the time when we actually didn't even know that we'd have a vaccine available. And so this kind of made me relive some of the anxiety that I had then, but also relive that incredible day. I think we heard about November 9th when they actually announced the results from the Pfizer trial. And just this incredible joy that we all had that science actually had succeeded in this instance and how well it succeeded. But I think it was very interesting to have both the highs and the lows of the vaccine development, but then also, our failures in terms of our ability to distribute this. And the other thing that I thought was incredible was this fly in the wall kind of view of this all, that you were kind of, to quote Hamilton, in the room when it happened, which is really quite an incredible thing. And it'd be interesting to hear from you how you manage that. In any event, so an incredible documentation of the successes, but also the failures, and we need to acknowledge that right now we only have 21% of people in low-income countries vaccinated, which is a goal that we had much earlier in the pandemic in terms of achieving that. And, I think that it's important that we discuss that as well tonight. But I'll put the first question to you, David. So, when you compare these two documentaries, kind of bookending, what has changed and how has it changed, and what hasn't changed and why hasn't it changed? So, simple question. I'll just put that to you. And see what you think.
Geez. Thank you, Nancy, and thanks for that great introduction. What has changed is what I was looking for when I started work on the documentary. The idea that there are so many lessons that were available to us from the HIV/AIDS pandemic, especially around the area of research and development and discovery, and also rollout. And I saw, and we all saw early on, the ways that scientists were working together, sharing information. We're taking on this crisis as a global crisis, and with the understanding that humanity really hung in the balance. I mean, everybody in the world was in lockdown. We were all at home. We were all glued to the television, trying to find any information we could about what was going to get us out of these rooms. And the researchers and the basic scientists, the pharmaceutical companies even really understood that and threw in everything it took to bring us through that discovery phase. And to have had that done in 11 months was phenomenal. I mean, it was, Dr. Tedros calls it the pinnacle of scientific achievement, and that was. I think we all had the experience that you had, which was this sense of thrill and relief, and just kind of overcome with emotion at the news that we would have a vaccine. The same period in HIV/AIDS took 15 years, and not for a vaccine, but for an effective treatment. 15 years before there was anything that could give that same kind of hope. And so the compression of that time period was really rewarding, and something I think we can say is the legacy of the kind of activism that was brought to bear in HIV/AIDS in those years, in those plague years of AIDS. Where my first film leaves off is at the discovery of those pills and the possibility that life would be ongoing, which was not expected before that. And what that film leaves out is the real human catastrophe that took place after that, which was that it took over a decade to begin to get effective HIV treatment out to the rest of the world, especially to the parts of the world that needed it the most. And that was, that's something that we will always remember as a failure of humanity, a failure of political will, a failure of governments and public health and pharmaceutical companies kind of collectively. And I was hoping we would see the lessons from HIV brought to bear in the rolling out of the vaccines. And as you see in How to Survive a Pandemic, those lessons did not come to play, even though so many of the same people were involved, and so many people were warning that we cannot repeat the errors of the rollout of the HIV medications, and yet we did watch that happen. And unfortunately, I think we still don't have the institutions in place and the political will in place to do any better the next time out.
I mean, one of the quotes, Seth Berkley, the quote saying, "Everyone says they want vaccine equity, but not everyone acts like they want vaccine equity," I thought was a great and illustrative quote from the documentary. And I think, Leith, I think this is something that you live in terms of trying to change this, trying to develop ways of getting therapies to people around the world. So what do we need to do to change this, to make this so that we do better now and that this doesn't happen again, because it seems to be history repeating itself. And like David says, we had lots of lessons to learn. We knew what all the things that we had to do were, and yet we didn't achieve it for this pandemic.
Yeah, I think the lesson for me from the international response perspective is that the institutions that we have, which were largely built in the post-war era, and then the big health institutions like the Global Fund and Gavi were built in the 2000s. They were built for a particular time and place, and they're no longer able to respond adequately to the sheer scale of the global threats the world is now facing. So the science delivered, and that should give us all, a great boost, because it will keep delivering. As long as we keep investing in science, it will keep delivering. But unless we nest our scientific breakthroughs in institutions that are capable to respond on a global level, we'll continue to repeat these mistakes, where it's really the most powerful nation states who can grab everything for their own people. And they will continue to do that because that's what they're built to do. So we can't really be critical of that. That is what a nation state is built to do. But we need institutions that are global and powerful enough to override the nation state when there are threats to humanity. And this, I think, was our first real global, truly global threat, in that every country, almost every country now has a COVID problem. So this was our first time we had to deal with something affecting every country, and the institutions simply failed. So institutions now need to enter a phase of transformation and reform. They're starting to do that. The WHO, the World Health Organization, has a big reform agenda. We just heard today the CDC in America has come out looking to really transform itself. But they all need to do this, and some pretty radical changes are needed. I don't know if we'll have the will to do it, but if we don't do it, we will just see a repeat. In a few years' time, when the next pandemic hits and we're told there'll be more, we will see a repeat. So I'm hoping we can muster the political will and the sheer people power to put pressure on our institutions to really go through what we went through after the Second World War, and that's to rebuild the global health and development architecture.
So I think that that's an interesting perspective in terms of how we try to make this happen differently for the next time, or even for the next, say, version of whatever therapeutics there are for COVID. I must say, Brett, being in Victoria, I really felt vaccine inequity for a large portion of last year, in terms of us being a high resource country but not being able to access these vaccines. And I forget who called it. Was it Paul Kelly? Someone called it the Hunger Games, the vaccine Hunger Games, and that we were very much the early on very much the losers in those games in Australia, and leading to our long lockdowns last winter. So you felt it from an Australian perspective. So how do you think globally we try to rebalance things, that we make it so that it's not think for yourselves only, not just first?
It's certainly a big challenge. I think it's a challenge of institutions, of our leaders, but also of the human condition, because some of that parochialism, some of that vaccine nationalism arises across populations, and the media and leadership are responsive to that, and the Hunger Games is fed by that general conversation. So I think we need to really promulgate the fundamental truth that epidemic diseases, pandemics in particular, in crisis, are a global issue, and that it's okay to be self-serving, but you have to do it with a scientific foundation, which is you need to address vaccine inequity because it's going to be good for you. And I think that was a failure. We saw the immediacy of the tensions that arose if we didn't have enough or didn't have it quickly enough, without recognizing that we needed to play the long game. We needed to ensure that vaccine distribution around the world would be for our benefit. And, it was spoken of in the movie around the dependence we have on the return to international travel and trade. But there's a bigger issue here, which is the development of variants of concern, and we don't know exactly how that might have played out if we'd had much more substantial vaccine equity, but there's every reason to believe that the opportunities for vaccine mutation would have been much, much less because we had a vaccine in those early phases that had very, very substantial efficacy against infection, against symptomatic illness. And the further we went on, allowing it to find a path out and around, the worse off we were, individually and collectively. And so I think that narrative needs to be lifted up. It needs to be amplified in media, and it needs to reach political masters who make some of these decisions. But of course, I recognise they're also subject to how we have those conversations and how we make those demands. And so we have to be the voices for equity at the same time.
Well, and you bring up politics, and that actually is a large part of this documentary about the interplay between politics and the science, and how in some cases science won, but in other cases, politics won. And you're certainly at the epicenter of the kind of intersection of politics and science in terms of public health. How can we better manage that? How do we move forward? Obviously, we have democratic governments, and you're the chief health officer, but you do have people you report to that are beholden to a democratic ideal. How do we improve or change the dynamic between the politicians and the public health officials so we don't see the kind of things happening that we had in the United States or even in Victoria, in terms of this tension between, there's always going to be a tension, but actually not following public health advice, which is now kind of what we're starting to do.
Yeah, look, I think it was apparent to me in the movie. There was a kind of scientific naivety. You could hear it in the voices. We've come to this fantastic discovery. We just need to make it happen, and everything will be okay. And so there was a naivety around how parochialism and nationalism would play out. There was a naivety that if you just spoke the truth around those scientific facts, that people would understand and accept. But we're in an age, and maybe now more than ever, where misinformation and disinformation are absolute poison. And Fauci, who had served with several presidents over decades and decades, was flabbergasted that he would say things and there was this visceral reaction, and that it became so deeply polarized. There is this notion of being able to inoculate individuals against misinformation and disinformation in advance. I think we need to do that. I think we need to be more nuanced in our understanding of that translational piece from scientific understanding to the complexities of our communities and our political landscape, to be able to say, I understand the science behind this, and I understand what will work, but we need to accept that we are going to face very substantial challenges in the way that it's used for other people's purposes, whether it's a cult following, whether it's subscription money, or whether it's just the sense that you're a contrarian. There are individuals who had very, very low trust in government, and they were a big driver of anti-vaccination sentiment. And we're not going to win with vaccine distribution if we don't also bring the behaviour change communication, the sustainable addressing of vaccine hesitancy and deep anti-vax sentiments. So I think we just need to bring the nuance and have a deeper understanding beyond that kind of scientific naivety that the technological solution is the be-all and end-all.
I think it is remarkable that we managed to globally distribute our vaccine misinformation, but not the vaccine, sadly. So now we have people not wanting the vaccine, even though it's available. And I thought a great quote in this documentary was Dr. Slaoui, I believe the name is, "Please, can the next pandemic happen not in an election year?" But, it's always an election year somewhere, right? To the documentary itself. So David, obviously you had, hours and hours and hours of footage. To get the footage that you had, you must have had cameras everywhere. What's on the cutting floor that you really wish you could have showed us?
Well, it's true. We did have cameras everywhere. And, at the very beginning of the pandemic, at the very beginning of lockdown, as public monies started flowing massively to private industry, as we realized that this might be the most consequential scientific undertaking of our lifetimes, I thought it needs to be documented. We have a responsibility to document it. We have history needs to know what happened behind those curtains. There's so much that's opaque about the field of science and research and public health and politics. So I reached out to just about everybody and said, would you allow us to come in? Would you allow us to record this and be witness to this for future generations, to make a record of this? And to my surprise, just about everybody said yes. I mean, there were almost no companies that said no, even though it was so risky for a company to allow us to come in. If they made errors along the way, we would have had the evidence of that. If they failed, they would have failed in a much more public way than many of them were comfortable with from their own practice corporately. And aside from Moderna, everybody said yes. And that includes many pharmaceutical companies you don't see in the film because we just couldn't fit them all in. So we have records from Sanofi, for example, and two of the Chinese vaccines we followed. And so there's so much about this idea of everybody kind of working together, working on the same problem, that we just couldn't wedge all of that into the film. And the idea that some of those companies were working with the promise that they were going to just release their working vaccines to the world without regard for profits, and those that were doing that or were making those arguments were unfortunately not among some of the better vaccines. So we just didn't include those either. But we did try to make sure that we had the notion of that kind of humanitarian instinct that some of the companies had, and to keep that fully cemented in the film. But other than that, we have all this footage that we haven't figured out what to do with yet, but we promised everybody that it would become available to historians in the future. So whatever didn't make it into the film will still be part of some future research efforts, I would hope, and will be part of the public record.
Well, I loved some of them, like the after dinner drink with Fauci. I thought that was just an incredible, ability to be there with him and talking while he was living this. This just
absolutely, and he was generous enough to allow us to come in. I've known Dr. Fauci for many years from my work in HIV/AIDS. I knew a lot of these folks because, as you all know, that the people who were in the position to respond to COVID were the people who had spent decades and decades trying to find a working vaccine against HIV. We still don't have that vaccine. It was interesting to see this bench of scientists who you would imagine might be dispirited from the work over the decades that had not produced what they wanted. But what they recognized was how much their work had advanced the entire field and made it possible to do this sort of research in such a fast basis.
We're going to be getting some audience questions soon. And if any of you want to come up and ask your question live, please let us know in the chat and we can invite you up. Leith, I thought some of the most powerful things in this documentary were related to, communities in the United States and how, there were a number of communities that were left behind and that it took community action to actually get vaccines, get help to them. And, powerful people like Father Abernathy and the work of communities. So we know that it's not just in low resource countries where we have this inequity, but we have it in our own backyard. And I know Brett has very in tune with this, with everything that happened in Victoria. How do you think in our own backyard we can try to address some of these issues of inequity, both for COVID, but for other pandemics in the future?
So I'm glad you raised Paul Abernathy, the amazing priest from Pittsburgh, because after you see all these scientists come on in the documentary, these amazing scientists educated at the best universities in the world doing amazing work, you think hero, hero, hero. And then you get to Paul Abernathy and his team, and you think, okay, these are the people who really should be celebrated as the heroes of COVID-19. Because they're the ones, what did they do? They had to vaccinate 1,000 people in 24 hours, and they did it. And you watch them do it. So that operation to me was, okay, that at the very micro community level, they got it right. What we failed to do globally, which was move vaccine and other treatments around the world to the people that needed them, they got it right. Yet I bet if you ask them how much financing support they got from any agency to do that, you'll find they did it with basically nothing, like community groups always do. But through the power of, you could see the trust when he spoke, the power of his words, how clever he was when he pulled out the Bible and started quoting the views on vaccines and doctors. So I think it's about finding those people. There's so many of them out there in every country, in every community, but they're always the last in line to get the resources and the support. And this happened in COVID too. We asked groups like that to do the impossible with nothing. So, and yet very, very large international organizations and companies as well have made billions and billions of dollars from the pandemic. It's just the way it works. A lot of money has to be raised and it tends to be captured at the top. Not too much trickles down. So part of what we need to do is, it's not just institutional reform that I mentioned before, but it's financial reform. We need to push resources down to the community level if we expect communities to prevent and respond to pandemics and health threats. And that's not happening at the moment. We don't have easy ways of resourcing these local groups. We also don't have easy ways of identifying them. You know, I'm hoping after this pandemic, someone does a good job, a massive global database, maybe this is something for a Google, of identifying all these local groups and linking them together, because they become the front line in the next pandemic. We have to have a direct line to them for next time, because they've learnt lessons, they're all networked now. We can't just let those networks dissipate and weaken and become fragmented. This is what the HIV/AIDS activism taught us. They wrote the playbook on this. You keep together, you keep strong, you never let it drop. So I'm hoping that there'll be financial reform and we can start identifying, networking these local community groups and getting money to them to strengthen them for next time.
So we have a question from Paula from the audience, on that community engagement that, reflects on what happened in the States, what's in the documentary, but was also wondering, and maybe Brett, you're the first best person to address this, is if you could share a bit to what extent such initiatives were going on in Australia as well, and were there some political initiatives to work more closely with the community leaders?
Yeah, it was one of the tremendous things to see through 2020. We weren't in a terrific position to begin with, globally in Australia, in Victoria, because these relationships and the trust and rapport gets built over lifetimes. And so you need to do the legwork, you need to build those networks and support them over a long period of time. But having said that, we were faced with a really substantial second wave in the latter half of 2020, and we identified those individuals and we empowered them. And there were vaccine champions, but we reached 5% of our entire Victorian population just through Zoom calls. That's how intensive the individual engagement was. And so there were bicultural workers, there were vaccine champions, and they represented their communities. And we didn't do it top down. We did it a little bit top down, but a lot of bottom up. And so asking the right questions about what information do you need? What are the modes and modalities that you need, the channels that you will use and hear, and then who would you like to hear from? And it's not the same for for one ethnicity there'll be 1,000 communities within one country of origin. And so you have to recognize that people will be influenced and open to very different people depending on where they're coming from and what their issues and concerns are. And so we did that, I think, very well in 2020, and we carried it through 2021. As you have identified, we weren't properly vaxxed until late in 2021, but that was one of the real successes. But we have to maintain those relationships. To Leith's point, you have to resource them and then make sure that they're ready to go and properly enabled for the next challenge.
Yeah, and I mean, I think when you're in a crisis, partnering with trusted community or community members is much more effective, and community organizations much more effective than trying to build that trust from ground zero. So it's just definitely the way to get things done when you're in an emergency. So Harry, would you like to come up and ask your questions? I think you had a few. Maybe while we wait for Harry to just pop up, maybe what we'll do is, looks like he's got a bad signal. So interesting question for David. What shocked you most throughout the making of this film?
Geez, I guess I was shocked over and over. I think the most surprising thing to me was the question of vaccine hesitancy, and we all were focused in the U.S. on populations that would have built-in histories of being suspicious of science, and those are mostly marginalized, mostly people of color in the United States, and a lot of hand-wringing around how to address the issues there and how to prepare those communities for the vaccine should it arrive. And that work, as we've already noted, was being done largely by people in those communities in conversation with the scientific community. A lot of those pathways had been established around HIV/AIDS research and through the clinical trials process that had been perfected over the last several decades. And the surprise to me was that the hesitancy was not hardened there, and that it was overcome relatively quickly. I wouldn't say easily, but quickly, and that the pendulum swung suddenly to working class white Americans, the Donald Trump base, and that group of people, it turns out, hold science in such disregard and expertise in such disregard that really the lasting hesitancy, the populations in the U.S. that have not been reached and may not get reached by the vaccine are not the groups that we were paying any attention to initially, and we don't have any strategy for how to address them, and we have not been able to penetrate them, and we've seen that happen through Europe as well. I'm not sure about Australia if that pendulum swing happened there, but it was, I think, a real surprise to the people who were trying to prepare the population for the next steps in this pandemic.
Leith, what did you find most surprising about this documentary?
Well, I have to make a gender point. I know you did your best, David, to get some women in at the end, and it's not your fault. Global health in this pandemic is largely run by men from the North, from the US and Europe. That point was well known and documented prior to the pandemic, but I think we saw it in the documentary, and it's true that largely the international COVID response, but also the response from the US and Europe, a few exceptions, was run by men. And I think the lack of diversity in global health leadership, particularly women from low and middle income countries. This is the group that we listen to least when it comes to health issues, is women from low and middle income countries. I think the response was weaker for that. I think there were a lot of individuals, I don't want to name any names, making pivotal decisions with no understanding of the realities of health on the ground in some of these countries. I'll give you an example. Oxygen, access to oxygen has been a huge inequity of the pandemic. Oxygen was never prioritized early on in the pandemic as a critical COVID treatment. And it wasn't because we weren't screaming about it, because we were. And as we finally got some oxygen response in February 2021, but it took us a year of very aggressive advocacy and action. And when we got down to it, it was because the small group of leaders, and it's like 10 or 12 men that were making decisions about the international COVID response in the early days, just didn't know that oxygen wasn't available in most hospitals across Africa, Asia, Latin America, and large parts of the Middle East. They didn't know. So that's still shocking to me, to see it laid out in the documentary as you go through all those. And they're very talented individuals. I'm not casting any aspersions on their talent, but we just don't have a team at the top making decisions about global threats that reflect the diversity of humanity. And all the while that's the case, we're going to get a less than adequate response, in my view. So it's another thing we need to change, is switch out our leadership. Let's have groups of people making decisions about global health that reflect all of us.
And I think this brings up another question. It's a good segue. And this is about decolonization. So is decolonization...
And you don't have a manifest outcome to show for it. What you show for it is clean water, clean air, people's health and well-being. And so when disasters happen, it just looks like a failure of public health. When we really need to build a narrative about what those invisible investments can really produce for us, and that the return on investment is unimaginable. How many trillions were spent in the response to this pandemic that could have been saved? But we can't say exactly what our next threats will be and where they'll come from and what they'll look like. But we know that there are some system issues that we can build in terms of their agility and adaptability and scalability and robustness. So we just need to build a narrative that says that core public health function will serve us really well into the future for whatever threats that might arise, if we can just understand what those pillars can achieve for us.
Leith, any thoughts to add?
Well, I can't see how we're going to, I mean, this is the hardest thing. Like building institutions, it's the hardest thing we do that are effective beyond national boundaries. But I just want to drop out there. I think for the young people that are in the audience, the students coming up through global health and development or politics, whatever they're studying, medicine, we need a UN 2.0. The United Nations architecture is broken. It's incredibly weak and under-resourced. If you follow the WHO, you've seen the wonderful Dr. Tedros. He's been a phenomenal leader during the pandemic. In fact, that team we see each week at the WHO briefings are a top team, but they do it with nothing. I mean, it's a very, very weak institution. So I think we need a new United Nations architecture. And until we have that, I am not optimistic at all about our ability to get any of this right. Because it's going to be the US versus China versus India versus it's going to be the same old competing nation states that we see. And then the companies, of course, the companies may have global ambitions, the big pharmaceutical companies and global markets, but they are nested in nation states. And we saw in India in the documentary when Adar Poonwalla from Serum Institute, when the Indian government knocked on his door and said, "You're not giving any more vaccines to COVAX." That was a fascinating interview you did with him, David. He said, I'm done. I'm not going to go. So the companies themselves are creatures of the nation state. So until we can invest in better UN architecture, and that's up to young people. You have to mobilize around these issues and get out there and be active. You know, if you go back to How to Survive a Plague, we don't see that level of activism anymore. I mean, it was hardcore. It was relentless. It was clever. It had a sense of, it had everything. We don't see that. Where is that? We need that again if we're really going to get the transformational change we need at the international level.
Well, speaking of young people, we have Paula. Paula has a great question I think would be excellent to find out from from the panelists as our final question of the panel. So Paula?
Yeah, thank you very much. So it's been really great to hear from all of you guys and to watch this film again. And one thing that I'd be really interested in hearing your reflections on is the sentiment that's expressed in the film and also a lot in general media and discourse right now of COVID as kind of a big disruption and the great opportunity for change, which I think gets thrown around sometimes in slightly insensitive ways, because I think it's also just extremely realistic to say that the first impact of COVID on kind of disadvantaged individuals and community has been to make everything much, much worse, and not somehow a great opportunity for change or for hope or anything like that. At the same time, I do see that a lot of the big changes, like the founding of the UN, have come out of crisis in the past, in kind of past history. So I wanted to see a bit how you guys feel about throwing around that sentiment in general, but also if you've got already some concrete examples maybe of how in the last 2 years that has been either proven or disproven in the work that you encounter.
Brett?
Maybe I'll be the cynic now following Leith. I think it's yet to play out. I would love to see really transformative elements. We've seen things at the edges, obviously, remote learning, remote medical consultations. There's a lot of embedded stuff that now happens at a distance, and I can see that work from home will be part of our futures regardless. We've discovered the joys of picking up our kids from school and helping with breakfast and the rest of it. But the big changes, I'm not convinced. I don't think there's been sufficient reflection on exactly what needs to change here. It's interesting to me, the estimated deaths for COVID now at 20 million, 5 million of those in India. They're the same statistics as for Spanish flu. A quarter of the global deaths that occurred 100 years ago were in India. And so a lot changes, but nothing changes at the same time.
Leith, what are your thoughts?
I'm going to continue with a bit of optimism. I'm really inspired by what's happening in Africa and how Africa has responded to pretty much being left high and dry by all of the international institutions that were supposed to be supporting Africa's health system in response. They are furious. If you speak to African leaders, they have had it up to here. They are furious. They're talking words like self-reliance, independence of our own global health institutions. Just today, there's more media as African leaders rally to take back, we're taking back our health systems. So this is definitely part of the decolonize global health and development agenda, but they probably wouldn't use that word. But I'm inspired by this new generation of African leaders that are saying enough, enough. We're going to take back our health systems. We're going to determine the priorities. We're going to have manufacturing in Africa. We're not going to be dependent externally for vaccines and medicines. They import most of them. And WHO is fully backing. Of course, Dr. Tedros is Ethiopian, so they have a strong ally in the WHO. But I think for the pandemic to one of the positives from it to be Africa drawing a line and saying we're in control here and you will enter our turf according to our rules, I think could be really transformational for the continent. But it's a rocky road they have to walk. But I love the kind of energy and leadership that's coming out of some of the African, and many of them young African leaders in health. Yeah.
David, I think when you look back at the HIV activism and what happened there, you do see at the end of the day the positive change that was made, that there was change that did help us now, that happened from what we learned from AIDS and that activism. Do you think that there's something that we're going to do better, learn better, grow, build back better from COVID? Or do you think we're going to just try and go back to life as normal and not kind of gain anything from this?
Well, I was going to mention, as Leith did, that I think where activism has had its biggest impact so far globally is in the decentralizing of manufacturing and production. And even just to control the discussion around that, which had previously, and even in the early months and years of COVID, been dominated by industry saying it's not possible. It's not possible to find manufacturing facilities in the low and middle income countries in Africa and Latin America. And that was just not true. The idea that the bottleneck was built in to manufacturing and distribution has been challenged and been proven both irresponsible and wrong. And that is, I think, a great legacy of the activism around COVID. But also on the very grassroots level, the activism of people like Father Abernethy, I think will have a lasting impact in communities, in relationship between community members and their own healthcare delivery systems. Certainly expectations have risen, and whether or not those expectations produce a new reality, we still haven't seen. The one movement that seemed to be a parallel movement that took hold, at least in the United States, after we were locked down was the Black Lives Matter movement, which has had a huge global impact, I think, on the way people talk about our relationships between marginalized communities and their governments and the enforcement arms of their governments. And I don't think that that conversation and the conversation around COVID are distinct. I believe that they belong together, and hopefully together they can help give us a lasting legacy from this pandemic.
And from my perspective, I think one of the things that has been an incredible change is one of my friends was saying that her elderly mother, who's non-medical, at one point was talking about the relative merits of, an adenovirus-based vector for a vaccine versus mRNA. And, probably not completely understanding what mRNA was, but, having some kind of understanding of what mRNA was, and who would have thought? So I think that although, there's a lot of anti-science and that became very apparent and maybe to many came as a surprise. Like to me, it came as a surprise how anti-science, how much of particularly the American population is. I think it also kind of really elevated science in the salience that people had, but also their actual fundamental knowledge of science. And now people kind of don't ask me if I'm a dermatologist. They know what an epidemiologist is, which is also. So with that, I think that we are at time, and I would like to thank for the audience. I would like to thank our fantastic panelists. So David Francis, Leith Greenslade, and Brett Sutton. Thank you very, very much for participating here tonight. Thank you so much, David, for chronicling this for us, so that we have this to reflect back on as a kind of contemporary narrative that allows us to kind of understand what we went through and something we can show to our grandchildren in the future in terms of this is what we lived. And also, I'm sure your archival material will be very useful from a research perspective for the future. I'd like to thank the organizers of the Global Health Film Festival for making this a really seamless evening. And with that, I'd like to wish you a good night. And definitely participate in the rest of the film festival. There are additional films to be viewed. And so I encourage you to participate in that. Thank you.
Thank you. Good night, everybody.
Good night.